So this includes findings from all the three states, Assam, Telangana and Maharashtra.
To understand the community's needs, awareness level, beliefs, behavior practices, and overall perception about NCDs. To explore various factors, both on the demand and supply side, affecting service delivery on NCDs. Understanding the knowledge and capacity of the health professionals like medical doctors, CHOs, on the prevention and management of NCDs.
And we said that NCD is such a program that, there would be an NCD clinic in any of the health facilities. The doctor or the counselor would be waiting there for NCD patients to drop in, or potential NCD patients to drop in, but they won't drop in. And then if you go out and randomly pick up some people and screen them for blood sugar, the random blood sugar could be 300. So you can see that. Then I won't talk about hypertension. Hypertension is similar. And if you have read the national NCD monitoring survey that we have done with ICMR, you'll see that many people with hypertension, they know that they have hypertension, but they do not take medicines. And some of them know that they are hypertensive and they take medicine and it's not under control, and they are not bothered to change the medication or do anything like that. So that kind of a disease we are dealing with NCDs. Every one of us are rushing to the hospital. It's a slow chronic disease which doesn't pass on from one person to another. It's not contagious, and that is why many of us are in a denial state. Maybe the burden is huge in the country, so we should take care of that. Then the hypertension people will say that if you take care of hypertension, then many of the K will be taken care of, but they won't believe. Okay, then we say, okay, we have to do something for the K, and we start the dialysis control program, the dialysis program, the Pradhan Mantri National Dialysis Program and other areas. Then the other C, no? The other C is for COPDs. Now, the COPD is missing in the NPCDCS program. Then we start working for the COPD component, and then we say that districts will have a facility for an opportunity for increasing the number of increasing the facility for diagnosing COPD. Naveen is here, so they have been working in that area, and NCDC has recently released the COPD guidelines. Then when we are still doing this, when we are struggling to do with the original ones and this new one, then the L people also can. Anybody can guess what is L? The L is for the liver. Then liver is a very complex organ. It has got infective as well as non-infective, and then alcoholic as well as non-alcoholic. Then we say liver disease means alcoholic. Alcoholic is for DDAP, which is already aware that the minister has already released, the previous health minister has already released the operational guidelines for NAFL, the inclusion of non-alcoholic fatty liver disease into the NPCDCS program. Like that, we are slowly trying to go a long way for increasing the number of facilities to be provided for NPCD, for the NCD program in the country, to the tune that we have about, say, in the CACs we have about 5,392 NCD clinics, which some of the study has done in the three states, and we also have in the districts about 677 NCD clinics. Now these are clinics where you have a doctor there, and you have a counselor there to do lifestyle counseling, and then over and above that, these are the basic NCD clinics. Over and above that, if you have cardiac issues, and if you are not able to travel to a tertiary care institute, something should be there in between. So in about, say, 187 districts, we have got the cardiac care units to take care of that situation. And then we have the state cancer institutes and tertiary care cancer centers for referral system of those people who are reaching there. At the beginning, it has not, for any program, the supply and the demand has to come. Let's say, for example, for tobacco control program, I work for tobacco control program, and we try to reduce both the supply and the demand side for tobacco. Tobacco should not be available, then I won't use it. No? Then if it is not available, I won't think. Now, today, many of us don't do drugs because it's not available. It's a banned item. So now, tobacco, for that reason, still it is illegal, but it is available. If you make it, exorbitantly high, if you make the price high by increasing the tax, GST 28% slab is attracted for tobacco products. But if you increase it high, then a rickshaw puller, say for example, if he has got 10 rupees in his pocket, then he will buy, if it is 2 rupees, he will buy, 5 packets of gutka or pan masala like that. But if you sell it at 10 rupees, then he'll buy only one. So like that, we have to work and we have to make, not available within, near the campus of the school, and all those provisions are there. So NCD, for that matter, what has happened is the service seekers also, no, they do not, as I said, they do not think that they could be potential NCD patients. We continue with our own lifestyle, and slowly because of urbanization and because of other social factors, we have gone towards a wrong direction in terms of NCD and so on. So we still continue to enjoy the cuisines of India, which is in many of them are very rich in calories and so on. And then we forget we are no longer working in the fields like our grandfathers.
Thank you, PPHF, for this opportunity to work with PPHF on this very important topic. I am Dr. Kavita Chaudhary from Sanofi. I head CSR. We are a pharmaceutical organization, a healthcare company, with our focus to see how we can improve the lives of the patients and the people. As part of our CSR, we are focusing on NCD, and as you've heard from Dr. Palu also, we are working with PPHF on projects in Maharashtra, Telangana, but we also have some other projects, and I would like to talk about that project a little more over here. Because Dr. Swastis Charan just mentioned about how it is important to talk to children about these NCDs. Before that, our journey began long time back, and even much before 2017. But in 2017, globally, we formalized, along with 20 other biopharmaceutical companies and World Bank and a few other organizations, started an initiative called Access Accelerated. As part of Access Accelerated, the aim is to improve access to prevention, treatment, and information for NCDs.
Formative research, more qualitative, findings of 3 states, supported by Sanofi and G Healthcare, and with the other associate like Samita. And these projects are in 3 states, Assam, and Telangana and Maharashtra. So 2 projects in Telangana and Maharashtra supported by Sanofi. There are 2 different models. We all know that urban health is a big issue and urban NCD, So the Hyderabad model is focusing more on the urban NCD, which is in the city, So unfortunately, we could not have those states represent today. Last minute changes happens because of state priorities. Similarly, with the and in Maharashtra, aspirational research primarily, more rural focus, and Maharashtra project little advanced in terms of implementation also. So we learn those 3 for the program. Because that's very important. Not research findings need to be applied for the program. So that part we have started, and some of the reflection you will see in our initial programs also. And I hope that the findings, one is will be more insightful for the state government programming. At the same time, those findings are every year, everywhere, even other state also. So we can see how those recommendation also can go to other programs by ministry and the health division that are working in several states. So we have good panel of distinguished leaders from the NCD and domain. So we'll also understand a couple of their insight today. Thank you.
This thought process of paying more attention to NCDs is the organization which I belong to. I am representing National Center for Disease Control, which till maybe 15 years back was named as National Institute of Communicable Diseases, NICD. So you can understand from the national perspective also that thought process change has happened, and it is continuing further, and it reflects in this name change itself. that now it focuses on environmental issues also and non-communicable diseases also. Sometimes the journey itself is the destination. Going through this process of creating awareness about NCD in different ways, by doing some activity, by doing some training, by creating some awareness, by doing the maybe same thing again and again with different people for the same target group also, it leaves such a big mark on their minds that yes, this is important and we have to do it. Like take for example any other thing like COVID. Last 1.5 year, whoever you are meeting, whoever you are talking to, whoever you are listening to, starts and ends the conversation with COVID. So same way, maybe slowly the time is coming where we are starting our talk and ending our talk and talking about NCDs. So I'm sure somewhere or the other it will lead to a big change. And my best wishes to all of you. Thank you so much.
So that doesn't make any difference if you don't disseminate your research both in the upward and the downward direction. Upward means to the policymakers and downwards to the people, to the program implementer. So in this context, this activity becomes very important piece sort of in the science, so that the whatever you found at the ground level can be communicated to the program people and similarly to the policymakers, so that effective intervention can be made. So I see this as a very important activity, and we have the audience, the state program officers, who will take the findings from this activity forward in the respective states and definitely make the case studies from the state so that it can be implemented in the other states. So really looking forward for the report presentation. Thank you so much.